Welcome back. We are continuing our discussion about the digestive system. We will be starting with the small intestine. The small intestine is the major organ of digestion and absorption. It is about 7 to 13 feet long from the pyloric sphincter to the ileocecal valve, where it joins the large intestines. It has a small diameter of about an inch to an inch and a half. The small intestine is divided into the duodenum, jejunum, and ileum. The duodenum is mostly retroperitoneal, about 10 inches long, and curves around the head of the pancreas. The jejunum is about 8 feet long and attached posteriorly by the mesentery. The ileum is about 12 feet long, attached posteriorly by the mesentery, and joins the large intestine at the ileocecal valve. Figure 23.1 shows all the digestive organs, but the subdivisions in the small intestine in particular. So we see the duodenum, the jejunum is coming down here, the jejunum is over here, and the ileum is at the end. This figure shows the relationship of the duodenum and the jejunum to the liver and pancreas. Notice how the duodenum curves around the pancreas. The superior mesenteric artery supplies blood to the small intestine. Veins carry nutrient-rich blood into the superior mesenteric veins, then the hepatic portal vein, and finally into the liver. The small intestine is innervated by the parasympathetic nervous system by way of the vagus nerve and by the sympathetic nervous system by way of the thoracic splanchnic nerves. The small intestine has modification to increase absorption. Its length, circular folds, villi, and microvilli increases the small intestine surface area extensively to be approximately the size of a tennis court. Let's go through the modifications. Beginning with the circular folds. These are permanent folds about 1 centimeter deep that forces chyme to slowly spiral through the lumen, allowing more time for nutrient absorption. Villi are finger-like projections of the mucosa about 1 millimeter high with a core that contains a dense capillary bed and lymphatic capillary called a lacteal for absorption. Microvilli are cytoplasmic extensions of mucosal cells that give a fuzzy appearance called the brush border. The brush border contains membrane-bound enzymes called brush border enzymes used for final carbohydrate and protein digestion. Figure 23.29a shows the modifications of the small intestine that increase surface area for digestion and absorption. We see the circular folds, which will spiral the chyme slowly through the small intestine, and the villi, which increase the absorptive surface. Figure 23.29b is an excellent diagram illustrating the small intestine's modifications. We see villi as well as microvilli, or the brush border. Within each villus there are enterocytes, or absorptive cells, enteroendocrine cells, and goblet cells. There are lacteals and blood capillaries. We also see an intestinal crypt with Paneth cells with a venule and lymphatic vessel directly beneath. Within the mucosa, we see malt, and within the submucosa, we see the duodenal gland. Make sure to study this diagram and understand its features. This figure shows the structural modifications of the small intestine that increases surface area for digestion and absorption. Notice the enterocytes, the absorptive cells, the mucus-producing goblet cells, and the villi. Here are what microvilli of the small intestines look like. They form the brush border. Absorptive enterocytes are indicated below the microvilli. Modifications of the mucosa and submucosa of the small intestine reflects its function in digestion. Intestinal crypts are tubular glands scattered between the villi. There are 5 main types of cells found in the villi and the crypts. Enterocytes make up the bulk of the epithelium. They are simple columnar absorptive cells bound by tight junctions and contain many microvilli. The villi absorb nutrients and electrolytes. The crypts produce intestinal juice, a watery mixture of mucus that act as a carrier fluid for chyme. The second type of cells in the small intestine are goblet cells, which secrete mucus and are found in the epithelia of the villi and crypts. The third cell is the enteroendocrine cells. These are the source of enterogastrones, like CCK and secretin. They are found scattered in the villi, but some are in the crypts. The fourth type of cell are Paneth cells, which are found deep within the crypts. These are specialized secretory cells that fortify the small intestine's defenses. They secrete antimicrobial agents like defensins and lysozyme that can destroy bacteria. The last type of cell are the stem cells. They continuously divide to produce the other cell types. The villus epithelium is renewed every 2 to 4 days. The malt protects the intestine against microorganisms and includes individual lymphoid follicles and Peyer's patches, which are aggregated lymphoid nodules located in the lamina propria. They are found in great numbers in the distal part of the small intestine, where bacterial numbers increase. The lamina propria also contain large numbers of plasma cells that secrete IgA. The submucosa consists of areolar tissue and duodenal glands of the duodenum that secrete alkaline mucus to neutralize the acidic chyme. Chemotherapy targets rapidly dividing cells like cancer cells. The negative side effect is that they also targets the rapidly dividing GI tract epithelium. This is the reason that many patients undergoing chemotherapy have symptoms of nausea, vomiting, and diarrhea. The intestinal juice is secreted at a rate of 1 to 2 liters daily in response to distension or irritation of mucosa. The major stimulus for its production is hypertonic or acidic chyme. Intestinal juice is slightly alkaline and isotonic with blood plasma. Intestinal juice consists largely of water, but also contains mucus-secreting duodenal glands and mucosal goblet cells. Chyme from the stomach contains partially digested carbohydrates and proteins and undigested fats. It takes the small intestine 3 to 6 hours to absorb all the nutrients and most of the water. Bile, bicarbonate, and digestive enzymes not from the brush border are imported from the liver and pancreas. Brush border enzymes bound to the plasma membrane perform the final digestion of chyme. Chyme entering the duodenum is usually hypertonic, therefore chyme delivery has to be slow and prevent osmotic water loss from the blood. The low pH of chyme has to be adjusted upward. Chyme has to be mixed with bile and pancreatic juice to continue digestion. The enterogastric reflex and enterogastrones control the movement of food into the duodenum to prevent it from being overwhelmed. After a meal, segmentation occurs in the small intestine. It is initiated by the intrinsic pacemaker cells. It mixes and moves the contents of the small intestine toward the ileocecal valve. The intensity of the movements is altered by long and short reflexes and the hormones. Remember, parasympathetic stimulation increases motility, while sympathetic stimulation decreases it. Between meals, peristalsis increases, initiated by the rise in the hormone motilin in a late intestinal phase. Each wave of peristalsis starts distal to the previous wave and is referred to as the migrating motor complex, or MMC. Meal remnants, bacteria, and debris are moved towards the large intestine. The complete trip from duodenum to ileum takes about 2 hours. This slide is included to remind you of how peristalsis and segmentation occur. So peristalsis is when adjacent segments of the alimentary canal alternately contract and relax. Food is moved distally along the tract. It's primarily propulsive and some mixing occurs. Segmentation is when non-adjacent segments of the alimentary canal organs contract and relax. Food is moved forward, then backwards. Primarily it mixes food and breaks it down mechanically, and some propulsion may occur. The ileocecal sphincter relaxes and admits chyme into the large intestine when the gastroileal reflex enhances the force of segmentation in the ileum. Gastrin increases the motility of the ileum. The ileocecal valve flaps close when the chyme exerts backward pressure, preventing regurgitation into the ileum. Table 23.3 explains the control of the motility in the small intestine. Increased gastric motility and emptying results in the gastroileal reflex and gastrin, which increases the motility in the ileum and the relaxation of the ileocecal valve. Distension of the small intestine increases the strength of segmentation. Reduced intestinal volume, or fasting, initiates the migrating motor complex and peristalsis, repeating it until the next meal. Table 23.2 is an overview of the functions of the GI organs. Please make sure to study this table. It has a lot of very important information. I will only be touching on some of it. The mouth and associated accessory organs ingest food, functions in propulsion phase of deglutition, and propels food towards the pharynx. The mechanical and chemical breakdown of food also occurs, with salivary amylase in the saliva beginning the digestion of starches. The pharynx and esophagus function in the propulsion of the food bolus. The stomach performs further mechanical breakdown and propulsion of the bolus into chyme. Pepsin begins protein digestion, and a few fat-soluble substances like alcohol, aspirin, and some drugs begin in the stomach. Intrinsic factor is also produced in the stomach. Hydrochloric acid produces its bacteriostatic agents and activates the protein digesting enzymes. The small intestine mechanically breaks down chyme and further propels it. Inside the small intestine, the chyme is continually mixed with digestive juices. Enzymes delivered from the pancreas and brush border enzymes attached to the microvilli membranes complete the digestion of all classes of food. The large intestine digests some of the remaining food residues by enteric bacteria. Water is mainly absorbed, and it propels feces towards the rectum for defecation. The large intestine has 3 unique features not seen elsewhere. It has tennae coli, which are 3 bands of longitudinal muscle, smooth muscle, in the muscularis. It also has haustra, which are pocket-like sacs caused by the tone of the tennae coli. And the large intestine has epiplotic appendages. These are fat-filled pouches of visceral peritoneum. All 3 features are seen in this upper picture.